Welcome everyone to another wonderful episode here, Doctors of Podiatry. We're here in our office-based surgical suite. I'm going to try to keep this very, very short and brief so I can actually upload it to Instagram. That's what I was told to do. So, without further ado, we have a young gentleman who presented to our office a couple of weeks ago with a severe case of chronic heel pain, which he has been battling for the course of
15 years.
15 years. The patient has tried some other therapies, none of which have rendered any type of clinical improvement. He presented to our office and I recommended that we perform a percutaneous plantar fasciotomy. The patient again has chronic plantar fasciosis, inflammation, degeneration of the longest ligament of the foot. So what I recommended, we'll keep this again, we're going to try to keep this very, very brief. What I recommended is to release the plantar fascia just ever so slightly to release that tension. Remember, the longest ligament of the foot, the plantar fascia, starts in the heel bone and it extends distally over here. It's kind of like the springs of a car, so to speak. This is a really great procedure, really effective. Again, thank you very much. The first thing we do, patient, if you feel anything, just please let me know. Okay, you should be, so we make a little step like that. Okay. What we're looking for is making a little pour over and under like that. And I already feel the ligament there. There it is. Now, what I want to do, Patty, is I want everyone, pressure? You okay? Okay, good. I want everyone to hear, come closer. I want everyone to hear the ligament is really, really strong, okay? And it's got this celery-like feel. I want everyone to listen. Right there. You hear that? I'll do it again. Okay? So again, I'll make a little port here, just like that. And again, there it is. There it is. And it's very important to identify the structure. Okay? Can you see from there? Or am I blocking the view?
No.
We're good?
Uh-huh.
Okay, good. There we go. So now, I take my little nifty and we're gonna release it. I go in this way, it's one side of the blade is dull, okay? So I know exactly there we go. And you can actually hear it like a celery-like noise. Right there. Okay. We have released it there. Now we go back here. Essentially what I'm doing is making sure that we released and we still have a little strand left. There we go. So now when I go like this, you see, when I move it up and down, there's nothing, you see? Well, we used to do this when we first started the procedure, you would feel, not only would I be able to feel the ligament, you would be able to hear it. Click, 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 click. So, believe it or not, that's the procedure. And again, it's really, really, really important to make sure, right, like that. See, I'm moving it up and down, up and down, up and down, and there's nothing there. It has been released. So the intended procedure has been accomplished. That's it. Dr. Wagner, where's the blood? Surprise, surprise. The patient put a little tourniquet on to make sure it's not a bloody mess, so I can see what I'm doing. So now what we're going to go ahead and do is release the tourniquet. And that's going to feel a whole lot better. So again, as everyone can see, this is what we call the hyperemic response. It becomes really, really, really red really quick. All the blood is rushing down, and you see a little bit of blanching, and that's because of the suture. We should have done this one live, maybe. What do you think? Was it too long? It's good. We're still good. 5 minutes. Is that good for Instagram? 4?
10.
What?
10.
10 minutes? Oh boy. Okay. Anyways, as always, www.jawspodiatry.com, Instagram, Dr. Tojam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel. I would like to take this opportunity to thank the patient for allowing us to do this little segment. Thank you very much. I would like to thank Patty for taking Caesar's place today. He's not going to be very happy, I can tell you that right now. And of course, Lisbeth, the circulator here today. Again, what did we do today? A percutaneous plantar fasciotomy for a severe case of chronic plantar fasciosis, inflammation, degeneration of the longest ligament of the foot, something that a lot of people battle and will or suffer during their entire life. Everyone, please have a beautiful day, have a beautiful weekend.